Trisomy 18 or Edwards syndrome. The association between this constellation of abnormalities and autosomal trisomy was first detected by Edwards. So, as the name suggests, this Edwards syndrome was discovered or described by Edwards in population based series of abortuses, stillbirths, and live births. Trisomy 18 approximates 1 in 2000 recognized pregnancies, while in Down syndrome, this is 1 in 450 pregnancies. High in utero lethality and termination of many affected pregnancies explains live birth prevalence is just 1 per 6600 or 10,000. Unlike Down syndrome and Patau syndrome, which may result from Robertsonian translocation because they involve acrocentric chromosomes, Edwards syndrome uncommonly stems from a chromosomal rearrangement. So, the etiology here is chromosomal rearrangement. Virtually every organ can be affected by trisomy 18. Common major abnormalities includes cardiac defects in more than 90% of the cases, particularly VSDs, cerebellar vermis agenesis, myelomeningocele, diaphragmatic hernia, omphalocele, imperforate anus, renal anomalies such as horseshoe kidney. Sonographic images of these abnormalities detect frequent cranial and extremity abnormalities are also seen in such affected fetuses. So, cranial abnormalities and extremity abnormalities are also seen, which can include a cranium which is strawberry shaped. Abnormal, what is a strawberry shaped cranium? Which is abnormally wide cavum septum pellucidum, CPs or choroid plexus cyst, micrognathia or a smaller jaw, clenched hands with overlapping digits, radial aplasia with hyperflexed wrist, and a rocker bottom or a club feet defect. Importantly, choroid plexus cyst only raise the risk of trisomy 18 in the setting of other risk factors such as fetal structural abnormalities or an abnormal aneuploidy screening test. In figure 16.5, trisomy 18 or Edwards syndrome is shown. Figure A, which shows a transventricular sonographic view, shows fetal choroid plexus cyst and an angulated skull which is strawberry shaped. So this is a strawberry shaped skull with wide cavum septum pellucidum. So the CSP or the cavum septum pellucidum is wide and an angulated strawberry shaped skull. Next image shows a radial club hand. So this hand is curved, also known as radial clubbed hand, is manifested as single forearm bone. Only radius is present and ulna is absent. There is no ulna, only radius is present with the hands in a fixed hyperflexed position at right angles to the forearms. The 3D sonographic image shows the characteristic hand position of a clenched fist with overlapping fingers and a rocker bottom feet where there is vertical talus. Pregnancies with trisomy 18 that reach the third trimester often develop FGR or the fetal growth restriction and their mean birth weight is less than 2.5 kilograms. When undiagnosed, trisomy 18 has resulted in emergency C-section for fetal distress in nearly 50% of the cases. Mode of delivery and management of heart rate abnormalities should be discussed in advance. Prenatal palliative care consultation should be offered to such mothers. In the National Birth Defect Prevention Study, median neonatal survival with trisomy 18 is 8 days. So survival duration is also less, which is around 55 to 60 years in Down syndrome, while in trisomy 18 it is 8 days. The 5-year survival rate is only 12%. Not unexpectedly, major abnormalities lower survival rates. Data from the Society of Thoracic Surgeons indicate that infants with trisomy 18 who underwent cardiac surgery have a mortality of 3 to 5 times higher than without trisomy 18. Thus, among the minority with trisomy 18 who survive until birth, the condition is severely life-limiting. Coming to trisomy 13 or the Patau syndrome, This constellation of fetal abnormalities and their association with autosomal trisomy was first described by Patau and colleagues. The incidence of Patau syndrome is approximately 1 in 5,000 cases. So the incidence of Edward syndrome is 1 in 6,000 cases, 1 in 2,000 cases, while for Down syndrome 1 in 450 cases, and in Patau syndrome 1 in 5,000 cases. So this is a rare chromosomal defect which includes abortuses and stillbirths. Most affected fetus are lost and terminated. The live birth prevalence is 1 per 12,000 or 18,000. At least 80% of the pregnancies with Patau syndrome results in trisomy 13. Results from trisomy 13. With a rare exception, the remainder are caused by Robertsonian translocation involving chromosome number 13. Most common translocation involves chromosome number 13 and 14 both, where there is Robertsonian translocation between Q10 Q10, which is carried out in approximately 1 in 1300 phenotypically normal individuals. Among translocation carriers, fewer than 2% give birth to live infants with Patau syndrome. Now, trisomy 13 may be associated with abnormalities of any organ system, including brain, heart, kidneys, extremities. Holoprosencephaly, usually alobar holoprosencephaly, is present in 2/3 of the cases and is often accompanied by severe facial abnormalities, which can include hypotelorism, cyclopia, microphthalmia, nasal abnormalities ranging from single nostril to proboscis. Cardiac defects in around 90% of the cases, and other abnormalities includes cephalocele, microcephaly, omphalocele, cystic renal dysplasia, polydactyly, rocker bottom feet, aplasia cutis, cleft lip palate, which may be median. Affected fetuses often have a bilateral echogenic intracardiac foci. For the fetus or the newborn with cephalocele, cystic kidneys, polydactyly, the differential diagnosis includes trisomy 13 and autosomal recessive Meckel-Gruber syndrome. So, those fetuses which are having cephalocele, multicystic kidneys, and polydactyly, the differential diagnosis includes trisomy 13 and Meckel-Gruber syndrome, which is an autosomal recessive syndrome. Trisomy 13 is life limiting, even more life limiting than trisomy 18. So based on lethality, among these trisomies, trisomy 13 is the most lethal, followed by trisomy 18, and least lethal is trisomy 21 or the Down syndrome. In the NBDPS or the National Birth Defect Prevention Study, the median survival of neonates with trisomy 13 was 5 days, while it is just 8 days with trisomy 18, and the 5-year survival rate in trisomy 18 was 12%, and it is below 10% in Patau syndrome. Occasionally, children with trisomy 13 have been the candidates for palliative surgical procedures. Most of these have a milder phenotype that lacks brain, cardiac, GI, genitourinary abnormalities. Counseling regarding prenatal diagnosis and managements are similar. And like other aneuploidies, fetal trisomy 13 confers risk to the pregnant women. Continuing pregnancy have at least 25% higher risk of hypertensive complications. So this syndrome, this Patau syndrome, is associated with hypertensive disorders if continued. The risk for preeclampsia with severe features. So severe preeclampsia risk is increased more than 10 times. So there is higher risk of severe preeclampsia and often develops prior to 32 weeks. That is preterm preeclampsia. Chromosome number 13 contains a gene for soluble. So this chromosome, so why this is associated with preterm preeclampsia? Because in the etiopathogenesis of preeclampsia, there is an association of SFLT1, which is soluble FMS like tyrosine kinase 1, and it is an anti-angiogenic protein associated with preeclampsia. So if chromosome number 13 is 3, then SFLT levels are high, and if SFLT levels are high, then there is anti-angiogenesis, which is associated with preeclampsia and exaggerated. Investigators have documented overexpression of SFLT1 protein in trisomy 13 placentas and serum with women with preeclampsia. Now coming to other trisomies, live birth are extremely rare. With other trisomies, other than trisomy 13, 18, and 21. Trisomy 22 have been described in case reports and series. Affected fetuses with trisomy 22 have severe growth restriction, microcephaly, abnormally shaped cranium, midline hypoplasia, and cardiac and genitourinary abnormalities. While trisomy 16 is the most prevalent trisomy among first trimester causes, accounting for around 16%. So, for first trimester abortion, most common causes chromosomal abnormalities, which accounts for more than 50% of cases. And is in these chromosomal abnormalities, 16% is attributed to trisomy 16, which is the most common chromosomal abnormalities associated with first trimester loss. Trisomy 21 and 22 are also common among first trimester losses, and trisomy 1 has never been reported. So, which trisomy has never been reported? Trisomy of chromosome number 1.